think based on the most recent data that we see, we have more to learn, but it certainly is giving us, reason to believe that what we're doing is working. We do want to slow it down enough so that we don't suddenly lift the restrictions and have more problems that we've tried to avoid this whole time.
Okay, it's April 13th, and we are back with Jennifer Greene of App Healthcare. She is the Public Health Director of the Appalachian District Health Department, which is the public health agency serving Allegheny, Ashe, and Watauga counties. I'd say very few people have a better perspective than Jennifer on the health of our area and how we are faring in the face of this crisis as a community. Just for reference, it's been a month since Trump declared a national emergency. It's been 2 full weeks that we've had a statewide shelter in place, which is crazy. It feels like an eternity. But we wanted to get you on here, Jennifer, for some updates about the spread of COVID in our community, or maybe rather the containment efforts. So thanks for coming back on with us.
Yeah.
First thing I wanted to ask is, how are we doing, do you think, here in the Boone area?
So I think what we can feel good about is that despite how difficult these social distancing measures have been, we are seeing progress in North Carolina, and certainly have seen our case counts have not grown as we've seen in other areas. And I do believe a lot of that is due to the leadership of our local government and the actions they've taken, as well as all of the people in our community that are doing their best to follow the guidance that has been provided and comply with the orders at hand, even though we know it's challenging.
So I know the governor came on and spoke today. Did he give some new orders? Was there some new guidance that's been issued?
Today, he really focused more on really what our long game is going to be, talking about how they are preparing at the state level to evaluate the epidemiology of where we stand. And I think last week there was a study that came out, and researchers from different universities in North Carolina who really wanted to point out the fact that we've done so well. But if we act too quickly to lift the social distancing measures, we risk having a rebound effect and really causing what we have been trying to prevent all along, which is overwhelming our hospital systems.
Yeah, so have we seen any cases at our local hospitals?
So we do not have any cases in the hospital right now. Today we did announce our 8th case. And wanted to just say that that is a resident who is a Watauga County resident, but they are actually living right now outside the state. So we are able to coordinate with other public health agencies in different states, different areas. And so we felt like we needed to let the community know, because the map certainly shows that we now have 8 cases. The map that North Carolina Department of Health and Human Services puts out every day, they update it, and it now shows that 8th case. But we don't see any risk to the community from that case. They are in isolation, and our close contacts are in quarantine where they are.
Do you think is it possible that there are more cases? Do you think it's likely there's more cases that we just don't know about, out of curiosity?
Yeah, that's a great question. So we have low cases, but we know that our strategy has really shifted away from testing lots and lots of people, at least at this point, and more towards telling people to stay home if they're sick. If they have mild symptoms, flu-like illness, we want them to stay home and call their doctor and do that instead of coming to get tested, unless they fall into certain categories. Really, people who are in the hospital, healthcare workers, law enforcement, other first responders, or if there's people in a congregate setting like a nursing home or group home, people in a detention center, correctional facility, homeless shelter, dormitory. Those are all really give rise to testing, just because we know that those settings are susceptible to spread. But because of that shift in strategy, we know that North Carolina does have evidence of community transmission, meaning the cases, sometimes you can't quite figure out what has actually been the link to cause that person to become ill. Locally, all of our cases are related to travel or close contact with someone who has traveled. But we know that there's certainly a good chance that we have community transmission happening, and we just don't have the lab data to back that up at this point.
Gotcha. So that kind of brings up the topic maybe of how we protect ourselves. Are you recommending masks? What's sort of your recommendations on how we go about making sure we limit the community spread and protect ourselves as much as possible?
Yeah, so obviously we want people to stay home to the greatest extent that they can. Getting takeout, going and getting the Watauga meal program that's been operated through the schools is certainly okay. So I want to make sure people know that we are in support of that. But protecting yourself, think about the last executive order that just came out. It's really to mandate more of the social distancing in retail establishments. But we know a lot of our businesses have already taken big steps to help prevent spread. Individually, you have a role to play, and I think each of us can think about avoiding crowds as one additional step. And masks you ask about, I do have my cloth mask here, so I'll just show you how you put it on, and it's got kitty cats on it because I like cats, but
Cool.
you notice it fits behind my ears, and it's over my nose, and it fits below my chin, so it's snug here, but it's certainly not cutting off my respiration. I can breathe and I can talk to you just fine. The reason this is important is because we know that we can be spreading the virus and not realize it. There is some evidence that supports that people who don't have symptoms might be exposing others. So really, this is not meant to replace those social distancing things that we're already doing, like staying home, avoiding crowds, washing our hands frequently, and when we are around others, keeping 6 feet of distance or more apart is very important. We know that if we use this as a replacement, it doesn't necessarily protect us. It's meant to protect others from our germs. So if you think about it that way, really what you're doing by wearing these when you go out to the store, when you have to make those essential trips to the grocery store, to the pharmacy, wearing these masks really shows that you care about your neighbor. But you can certainly do your own thing. You can get a t-shirt and cut it and fold it and use rubber bands and loop it around your ears. The main thing is you want it to cover your nose and cover your chin and fit around your face, but not cut off your breathing, obviously. You want to be able to still breathe. And they are important to clean, so you want to wash them just in the, launder this in the, with my washing machine and get it in hot water and let it air dry, or you can dry it. It's important that you don't just continue to wear it, but you clean it. But it's really meant to be a preventive measure for others. And I think it's important. We will see more and more people wearing them. If you're in a healthcare facility, more healthcare workers are going to be wearing masks now. And we do recommend the cloth masks for the general public because we want the other masks to be saved more for healthcare workers. But you will see more people wearing these masks, and the reason is because we're trying to prevent anyone from spreading the virus unintentionally. Because some people we know may not have symptoms or may have very mild symptoms and not even notice it.
That makes sense. Any guesses on how long you think we will be wearing these masks? I mean, if you were to take a wild guess.
A wild guess, I say it's going to be like pre-COVID-19 and post-COVID-19. I think we might be wearing these for a bit.
Yeah.
I don't know exactly. I think we'll have to watch and see how well we do with bending the curve. But I think, everything that we're doing right now is certainly going to be important for the days ahead. And when we do see things start to shift more towards lightening up these restrictions where we feel like it's safe to um, have more people congregating, at least slowly, but eventually we see that happening. These masks could be a very important tool because they could help prevent us from spreading the virus to others. We know right now when we do what's called contact tracing, when the public health staff interview someone who is sick and has COVID-19, one of the things we do is we look back 2 days prior to the point when they actually got sick. So 48 hours, they could have been spreading the virus before they had symptoms. And that's another reason why that mask is pretty helpful.
Gotcha. One question I'm just curious of your thoughts on as the health professional. It's spring break right now. The kids are technically not doing any school classes. They really want to get out there and play with friends on the street and that kind of thing. And I don't know, it's definitely been a little bit of a debate among parents is how do you handle that? What's your recommendations? Do you keep the kids locked up as much as possible or let them get out there and have some fun with their buddies?
It's important to have balance in all of this, and we still want people to maintain distancing. We don't want people to gather in groups of 10 or more, but being active and being outside is good for our mental health. It's good for our physical health. And so to the greatest extent that we can allow that, that's why we've left here locally. There's trails open and there's walking paths open. Those outdoor activities are really important. And we know that though we have a lot of resiliency in our community, our kids are also, this is hard for them. This is a big challenge. They've gone from really being in school with very much structure to having to learn what it is like to navigate this new process. And I think, our school district has done an incredible job of trying to help support students and families. And still, we know that even for all of us as parents, this is a challenge. So I think that is very important to allow kids some activity, and all of us as adults getting outside and taking a walk, keeping our social distance, but allowing them to play and be active is important. And the reason that you see some of the playground equipment and those shelters that are marked off is because we don't want to encourage gathering and crowds, but we do certainly support people being outside and being active.
Gotcha. I might ask you to pull out your crystal ball here a little bit, just around this idea of like light at the end of the tunnel. Any thoughts on, are you seeing that, or any thoughts on how long we're going to be sheltering in place? Just from your perspective, what do you think?
I think based on the most recent data that we see, we have more to learn, but it certainly is giving us, reason to believe that what we're doing is working. And I think that what we're doing is working is very important because we know that it's also hurting. If you're in a business industry, it's hard. We just celebrated Easter and Passover, and people didn't get to celebrate in the same ways that they are used to doing. And that's challenging. And yet we are seeing every reason to believe that it's worth it and it's working and it's important. I think that we will likely be seeing, weeks ahead, more of the stay-at-home order, and I do believe that Governor Cooper's address today certainly may have inferred that he was certainly looking more at that, and some of that is due to the data that we see with the virus, and we do want to slow it down enough so that we don't suddenly lift the restrictions and have more problems that we've tried to avoid this whole time. We want it to be worth it in the end, and I think we are likely going to be seeing more weeks beyond April, but that's my guess. I would wait to see what the data actually shows before we would know for sure.
Yeah. All right. Well, thanks for sharing your thoughts and for coming back on and giving us updates. We really appreciate what you're doing.
Yeah, thank you. And thanks to everyone. I want to just give a shout out to all the healthcare workers and everyone else who's working so hard. We have an amazing community and a lot of people who are supporting, and I do hope everyone continues to support the Keep Boone Healthy campaign and Take Out Tuesday. I think it's very important for us to also do what we can along this journey to try to support our local businesses too.
Yeah, I fully agree. All right. Well, best of luck out there. And maybe we'll talk to you again before it's all said and done.
Okay.